Hello, I'm Dr. Lipi Roy, and welcome to my show, Health, Humor, and Harmony. In May 2008, the United States House of Representatives announced July as Bebe Campbell National Mental Health Awareness Month. Ms. Campbell was an acclaimed author, advocate, and co-founder of the National Alliance on Mental Illness, or NAMI, Urban Los Angeles, who sadly passed away in 2006 from brain cancer at the age of 56. In today's episode, I'll talk about the unique mental health struggles facing racial and ethnic minority communities, and I'll discuss ways you can have a positive impact on mental wellness. Let's get started. So, why am I specifically discussing mental illness in minoritized groups? It's because studies show that people from racial and ethnic minorities are less likely to receive mental health care. The COVID-19 pandemic has further widened the healthcare disparities faced by minoritized groups in the United States, mental health care in particular. Each ethnic group faces a unique challenge to their mental health. Here are 4 examples. First, Black adults in the United States are more likely than white adults to report persistent emotional distress. And those living in poverty are more than twice as likely to report serious psychological distress. What's most troubling is that only 1 in 3 Black adults with mental illness receives treatment. Number 2, more than half of Hispanic young adults aged 18 to 25 with serious mental illness do not receive treatment. In 2019, suicide was the second leading cause of death for Hispanic teens and young adults aged 15 to 34. Point number 3, Native or Indigenous people in the U.S. report experiencing serious psychological distress 2.5 times more than the general population over the span of 1 month. In 2019, suicide was the leading cause of death among Native Americans between the ages of 10 to 34. Fourth, Asian Americans are 3 times less likely to seek mental health services compared to their white counterparts. 1 in 5 South Asians in the U.S. report experiencing a mood or anxiety disorder in their lifetime. South Asian women report higher levels of distress than men. Asian Americans also experienced increased stress and anxiety related to xenophobia and anti-Asian discrimination during the pandemic. All of this data is deeply concerning, as it clearly shows that certain minoritized groups are suffering from mental illness but are not getting the evidence-based treatment they need and deserve. So, why do these disparities in accessing mental health care exist? Here are 3 major reasons. First is stigma. People with mental illness face tremendous stigma, prejudice, and discrimination, and are marginalized because of this brain disorder, i.e. mental illness, that is poorly understood by society. Inaccurate or misleading representation in media and Hollywood further perpetuates stigma and prevents people, especially those of ethnic and racial minorities, from getting help. Second is lack of insurance. Unfortunately, people of color are far more likely to be uninsured or underinsured in the U.S., leading to multiple disparities in health outcomes, including higher infant and maternal mortality rates among Black mothers and babies. And third, mistrust of the healthcare system. Lack of trust in U.S. healthcare professionals is worst among Black Americans, and not at all unwarranted, as the U.S. medical system has a long history of mistreating Black men and women, from forced sterilizations of Black women to undertreating pain in Black adults and children. So what can we do to bridge this egregious gap in mental health care services among minority communities? First and foremost, we need to increase access to mental health treatment and care to Black, Brown, and other minoritized groups. Healthcare organizations need to actively engage in community outreach, partner with faith-based leaders, host community fairs, town halls, post culturally appropriate flyers, and create confidential telephone helplines and apps in different languages. We also need more racial and ethnic diversity within the healthcare system, as patients of color are more likely to trust medical professionals who look like them. Ultimately, we need to reduce the stigma faced by people with mental illness. Let's talk openly about mental health. Let's educate ourselves, our loved ones, lawmakers, teachers, the media and entertainment industries, everyone, about mental health being a brain disease that needs to be treated the same way as any other physical or medical disease. We also need to be mindful of language and avoid stigmatizing terms like crazy, psycho, lunatic to describe people with mental illness. Last but not least, we need to increase funding for mental health services. Some positive news, though, on that front is that in March of this year, the U.S. House of Representatives approved $2.14 billion for the National Institute of Mental Health, including $20 million to expand research on the impact of the COVID-19 pandemic on mental health. So, how can you get involved? Use empathy and kindness when someone close to you shares their depression, anxiety, or other mental health issue, and encourage them to seek professional help. Use non-stigmatizing language and speak out when media, music, fashion, entertainment, and other powerful industries stigmatize people with mental illness. You can also volunteer with or donate to amazing organizations that are working to improve mental health care access for minoritized groups, such as Black Mental Health Alliance, Black Women's Health Imperative, South Asian Mental Health Initiative and Network, and many others. Well, that's all for today. Here's your joke of the day. What does a storm cloud wear under its raincoat? Thunderwear. Well, that's all for today. I'll see you Wednesday, 3 p.m. Eastern, when I'll be discussing the impact of the Roe versus Wade ruling on IVF. Be sure to subscribe to my YouTube channel, write comments below, and follow me on Instagram at Health Humor Harmony Dr. Roy. Be well. I'll see you soon.